working for GSK Vaccine. He's an eminent member of ISO TC15 Working Group 6, where he represents the European pharmaceutical industry. That was the opening slide. He is the one who presented a few weeks ago the webinar on IDMP and Falsified Medicine Directive. So now I want to give the floor to Jean-Gonzague, and we'll unmute if I find you on my list. So here we are.
Okay, yes. I was asked a few weeks ago, so when I did the first presentation on Falsified Medicine Directive, to add this this complement to the presentation. At the initial presentation was not focusing so much on some very specific aspect, some more specific aspect of intermarket transaction and parallel import or parallel trade. So here is a few slides that have been made by EMVO, so specifically Paul Mills. We discussed this slide quite some time to make sure that everything is clear. So it's not my slide, it's really the information coming from EMVO for the, let's say, the standard aspect, the one from the technical and system perspective, and I will bring also some of my experience with GSK as a user, in fact, of this of this aspect. So next slide, please. So yes, as I said, there is two main topic today: intermarket transaction. I will explain later what it is, and parallel distribution. So it's two different cases related. It seems to be the same because basically it's drugs that are coming through borders, but it's not exactly in the same context. So next, oh yes, EMVO. EMVO stands for European Medicine Verification Organization. So that's the organization, I think it's led by FPA members, if I'm not misleading, that is in charge of playing, let's say, playing the FMD, Falsified Medicine Directive regulation. So EMVO for the organization and EMVS, European European Medicine Verification System, sorry, is the supporting technology below that do the stuff really. And I will also speak NMVS at some point in time, which are the National Medicine Verification Organization, that the replication of the EMVS in each countries. So next slide, Christian, please. So a few about EMVO. So intermarket transaction in the EMVO context. So everyone in the European market can decommission packs through requesting a control to the MVS or the NMVS. So most of the time what's happened is a pack in a country is decommissioned in the country it is intended for, because us as GSK, when we deliver a drug for France, we deliver it in France, it's used in pharmacy in France, so it's decommissioned in France. But sometimes it happens that a pack is decommissioned in another country for some good reason. And for example, if we have a specific pack, which is a Spanish pack that is decommissioned in France, then it will be we will need to have these additional checks. Also, there is some specific European regulation, like the Article 126A, which is basically the capability to license in a country without doing all the administrative regulatory requirements. So it's a bit like, let's say, a light authorization. So in this case, it might be that we don't do a pack for this specific country, but we use this specific article to bring a pack in a country. So when we have this case, a pack that is not intended for a specific market that is decommissioned in that market, then the IMT system is kicking in. Next slide, Christian. So IMT, it's really basically a query from a system to decommission or verify a pack that is where the data are not all is in the national medicine verification system. When us as GSK, we load data in EMVS, we load all data in the European hub and saying, guys, these data are for Spain or for France or for Italy. And then the European hub will push this data in the national system in France, Italy, or Spain. So when I have my pack in Spain, I have the data in the Spanish system. What's happened when I have no data because I have a French pack in Spain? Then we have the AMT, and the objective of this system was for, at the very beginning, for Luxembourg. The Luxembourg didn't want to have an NMVS at the early time of EMVO. And in Luxembourg, most of the pack are coming from the border countries, so Belgium, France, and Germany. And so if they have no NMVS or shared with Belgium as it is today, a lot of pack that are from Germany will not be in the Belgium Luxembourgish NMVS. So then the European hub is asking, kicking in the system to ask to the specific NMVS where the data are held to validate the transaction. So if I am in France with a Spanish pack, it will ping the national system in Spain. Next slide, please. Next is the previous one. So that's what is depicted on this slide. It's a fully synchronous system process where as soon as the pharmacist scan the pack, then it triggers a query to the national MVS, which says, I don't know this pack. Then it's going to the European NMVS, to the EMVS, sorry, saying this pack is for that country. So it's triggered a request to this national MVS, where is the pack? And then there is the answer from the originated system. So again, same example, I'm in Belgium with a French pack, it will ping the Belgium NMVS, nothing, EMVS, go back to French NMVS, okay, this pack is legitimate, the message is back to EMVS, back to Belgium NMVS, and say, okay, you can dispense this batch. So this is a very fast process. As you see here, it's more or less 1 to 2 seconds on the lower diagram max to get the answer. Next slide, please. So to summarize, this system is really to be able to handle pack that are out of their intended market for some reason I meant before. However, what's happened is there is more and more, let's say, way to use this system for other purposes, like Paul said, improper pack movement. And so this can create issues at some point in time. It can also create sometimes the issue within companies for us, because we get some requests from other countries with strange reason. However, at least all this is tracked, and it can be audited at the EMVS and MVS level. So the NCA can say, okay, there is some issue there. Why I have so many packs from that country coming? So we can still trace all this aspect. So this is for IMT. Do we make a pause now to ask for question, Christian?
Yes, absolutely.
I don't know if there is some question of IMT so far.
I remind you that you have to use the chat box, and possibly I will give you the mic after. For now, we have just a comment that on one of the slides, the article 76 from the Directive 201/83 about the parallel distribution is missing, but we will send that to the author. And ENVO, as another colleague mentioned, is not only FPR, that was a shortcut. On the introduction slide, you had all the acronym and the name of the stakeholder for the ENVO.
Yes, yes.
Not only medicine for Europe, but it is also for Europe.
Yeah. So if there is no question so far, we can move on to parallel trade. Maybe, Norman?
A European Union universal barcode for medicine. I think Jean-Gonzague, you are well positioned to answer.
So we have the data matrix. FMD is mandated the setup of data matrix on packs. So this is the GS1 standard that applies here to have on each box this data matrix that's contained the product code. So most of the time GTIN, not to say always. Serial number, expiry, lot, and
NHRN.
And yes, national number, national reimbursement number.
Yeah. But the Commission is not mandating GS1. The Commission is mandating the use of data matrix, which is a data carrier. And it happens that on the European markets, the most known or the most frequent combination of content and barcode is GS1. And FMD is for prescription only, or mainly for prescription and a few others. That's correct.
Vaccine also in scope.
Yeah, prescription, I suppose.
Not all.
Not all. Okay.
Okay. So if there is no more question, we can move on to the parallel distribution. Yeah. Okay. It's already there. So parallel distribution is linked to parallel importers, parallel distributors that are company seen as manufacturers because their objective is to, let's say, yes, bring some drugs bulk in a bulk way from one market to the one. So they are seen in the EMVS system, in the EMV organization, as full OBP. OBP standing for onboarding partner. Basically, an OBP is an organization that is allowed to load serial number in the EMVS. They are a bit different than an MAH like GSK because there is some different kind of connection with the EMVS. But I mean, for today, we can just say it's similar than an MAH, a manufacturer. Next slide, please. So what is their business model, these guys? So basically they buy bulk drugs from one market and they rework the pack, for example, opening, making smaller pack or making bigger pack, and then they put this pack back on the market, on the same or another market, where there is a need, where there is a good reason for them to make a business. And that's where the pack size element in FMD regulation is very important. And it's not the pack size at the regulatory sense. Because when I say that I open a box of 14 pills, and I make from 2 boxes of 14 pills, 1 box of 28 pills, it's a different, I mean, the pack size then start to make a lot of sense because we need to make sure that what we have at the beginning, when we remove this existing pack from a market to repack and put them back on the market, we need to make sure that we are not putting in the system some falsified drug. And so that's why this pack size as FMD is the number of repackable dose form contained in the pack to be able to count them. So that's also the reason why when we have a syrup in a bottle, as we will not open and repack the liquid, the pack size of the bottle is 1. And so the example of amoxicillin on the lower part of the slide, 28 tabs of 250 milligrams, it's the pack size, it's 28. But if we take the case of contraceptive pills, a 28 pack of contraceptive pills, it's still 1 because all the pills are not the same and you can't open the blister and repack them. Next slide. So as I said, there is a critical activity here for parallel distribution is the number of those. So there is this notion of buffer in the EMVS. So the buffer is created when the parallel distributors remove all his packs from a market. In the EMVS, they create the buffer counting the number of box cross the number of the dose count per box. So if I remove 1,000 box of 28 pills, then the buffer is 28,000. Then the parallel distributor is doing his business, repacking, whatever, and he has to recommission this batch, these boxes, these pills in the system. What's going to happen there during the commissioning is to check if the parallel distributor is going to recommission the same number of pills at most than what is present in the buffer. If I have 28 packs of 1,000 packs of 28 pills, 28,000 pills. If I do 56 pills back, I will not be able to commission more than 500 packs because it will be also 28,000 pills. So that's what the important here with this buffer notion. Of course, during the process of repacking, the parallel distributor has to reassign a product code, reassign a lot number, reassign all these aspects linked to the different element that enables the tracking of the drug. All of that need to be reassigned to the new pack. Next slide. So this is a small diagram, small example of how it works. First is the decommissioning. Then there is the buffer that is created with all the information. The former serial numbers are retained, so they are kept in the system for traceability. And then when the work is done, recommissioning, check the number of those and so agree on the recommissioning. And so the small example below is a bit the same what I said earlier, the 1,000 pills and so on. So it's a bit small. I'm not sure you can read on the screen, but you will see on the slide when they will be distributed. Next slide, please. So the process, it is a bit detail on the process, everything about how to scan packs and so on. This really to give you all the detail of how it is done. Also with the, again, importance, as I said earlier, new product code, new batch, new serial number. This is key in this process. Next slide.
Yeah.
So in summary, really to re-emphasize on the meaning of pack size in the frame of FMD, it's really a dose count, repackable dose count of what is in the boxes. All this is done, there is some regulation that are let's say covering all this work, and the EU hub is processing all the checking aspect linked to this transaction. I don't know if there is some question on parallel distribution. The next slide is the one for the question. Or even on IMT.
I just see in the chat box that one colleague makes a comment saying it is awfully complicated and he is wondering the business model for all that. Actually, it is a fair question. It is a fair question, but it goes a bit beyond our purpose here. The business model is not exactly in our scope. Understanding that there must be a business model because we have this, as you noticed, a quite complicated situation and process. So we'll just take this into account and leave it as it is. For us, the purpose is to understand that we have a GTIN change at some point of time. And this is another question. Can you perhaps, Jean-Gonzague, elaborate a little bit on this GTIN change towards the PCID? How do you see that?
So the GTIN, yes. So there is some element that define the GTIN, and amongst other, the size of the pack is one of the aspects in the GS1 healthcare allocation rules. So so as soon as the size of the pack is different, immediately it's immediately no-brainer that the GTIN will change. Another aspect is the GTIN is constituted of several pieces, and basically a GTIN number is owned by an organization. This is the first digit of the GTIN. If a parallel importer is doing some repacking activity, he will need to assign his own GTIN because he cannot assign, for example, the one from GSK. He has no right to do it. We are assigning on our own our numbers. So yes, there is a new GTIN for in this case that are generated. So the link with PCID. This is a bit more tricky. If we think that we repack for the same presentation that is already existing in the market, we could imagine that the PCID shall be the same. However, the parallel importers need to have a parallel importer license. And I don't remember the system at the European level, the name of the system at the European level, but basically they are registered and they have a kind of license to make this parallel import. So it is not, for me, it's not completely clear, even with the EUIG as they have been written so far, if the PCID will change, even if the PMS ID will change in the frame of parallel import. This is maybe a question that I would send back to chapter 2 and chapter 3 in the EUIG working groups with Carlos and the others at the EMA. But this is something we need to think a little bit more in the frame of the EUIG. It is more linked to the way EMA want to manage licenses than to a really supply chain problem.
Thank you. I think this is an appropriate question today because the consultation for the next edition of the implementation guide will go live in a few days. And for those who are not aware of, we have another run of discussion with Emma about the relationship PCID and so data carrier identifier. I have also another good question on the chat. What happens if you have a parallel distribution from an OTC country to an RX country? That means a product supposedly not serialized in country A because not under the rules of the Falsified Medicine Directive is parallel exported to a country where that product is a prescription and should then be serialized. Do you know that? If you don't.
So, no, not really. That's a very weird example, weird question. So, no, I must say I haven't gone so far in the research for this presentation. So, I will take the question to Paul.
Okay. Norman Schuff from FDA say, I understood that there are several ISO PCID levels and that none includes packaging. Is that correct? It is.
So I'm not sure to understand why say there is one PCID, so not several levels. I mean, I'm not sure to understand the notion of levels here. The package item container, the PIC, then there is several iteration of this package item container, the outer box, the blister, for example, or the bottle in the box. So this is the two iteration, for example, for amoxicillin, the box, the blister, and then the manufactured item. So at each level, we can assign a GTIN on the box, a GTIN on the blister, even a GTIN on each pills potentially. And all them are linked to the PCID to the authorized presentation. So if the authorization is for Augmentin 28 pills in a box, there is one PCID for Augmentin 28 pills in a box, and below this PCID, I will link one box of 28 within the box 2 blister of 14 and so on. Sorry.
No, it's good, but the question has been corrected. It was not different level of PCID, but PHPID.
So the PHPID is on the other side of the model, linked to what is administered to the patient. So yes, there is several level on the PHPID. It's not the PCID, but they are connected through the medicinal product.
Okay, but this is, this is a good question in general, but it is not linked exactly to the topic of cross-border supply chain. Another question is still in this context. What are, in these transformations of pack from one to another country, the obligations of language on outer packages and inserts, and the consequences? So the packager has to use the local language.
Yes. That's a simple and straightforward question. They have to take the information provided by the marketing authorization holder.
Yeah, but in that country. So if you have a parallel trade between Greece and another country such as Germany, perhaps the Greek language is not allowed in Germany. So there must be a repackage, including the reset of the information which are on the pack. And that goes a bit together also with the assignment of a new GTIN. And that would be probably certainly the same for OTC. I mean, it's nothing to do with the fight against falsification. Do we have other questions in this domain? So I read the next question. In my understanding, the governance assignment process for PCID and GTINs are different. Assigning authorities are different. If that is true, how would we expect to mix them? I think it makes sense to have some matching, but no equivalence.
So that's a very, very and very hot topic, very interesting topic. Yes, the PCID is a regulatory representation of an authorized pack with a regulatory life cycle. The GTIN is a supply chain identification of a pack with a supply chain life cycle. So to say it simply, PCID can change without GTIN changing. GTIN can change without PCID changing. So they are just totally independent. And that the beauty of the IDMP model is this model enables a reconciliation of a regulatory life cycle with a supply chain life cycle. And they can, basically each of them can do their own job at their own rhythm, pulsing at their own rhythm, without disturbing the other one, without having to connect with the other one. The IDMP model is doing it smoothly without the need of complex mapping and so on. So it's not really a mix, it's more a complementary. The Genie is really the complementary side of the supply chain reality, complementary side of the regulatory reality.
Exact. Do we have another question? I see nothing popping up.
Christian?
Yes. So no other questions. So I propose that we now...
It's me or?
It's you. What is you?
Hello?
You don't hear me? Do you hear me?
Can you hear me, Christian?
Yes. Yes. And you should hear me as well. Yeah.
Hello, Christian?
Yes, you don't hear me?
Ah, okay. Yes. During 10 seconds, there was no sound. Okay, it seems that everyone can hear me, but I can't hear you, Christian.
You don't hear me?
From time to...
Okay. So Norman says here, both everybody...
Okay, Laure said we can...
Okay, no, it seems to be okay. But that's
Yes.
the mystery of sometimes the Wi-Fi connection. I suggest we now move to more broader questions. So Jean-Gonzague is still with us, of course, and he will be certainly happy to note or answer, depending, other questions you may have. So, but now the floor is more open to questions. And I invite you again to use the chat box. If the question is concise and self-explaining somehow, I will read it for everybody, and then we search the answer. And if the question is more complex, then I will give the microphone to the person who is asking. So I'm waiting for first question on the chat box. But I don't see any. Whilst you are thinking about the questions, I want to perhaps in phases why we have this open discussion, open. There are many reasons. One is it is not limited to UNICOM people. So external people can join it. It is not limited to a specific topic, like here, FMD and IDMP. It is open. You may have a burning question in a work package, and you would be happy that somebody from another organization, which is not, that person is not actively involved in UNICOM, then it is the right place to ask. Oh, now I have a first question. This is a really burning question. What are the reasons given to not include GTINs into SPORE? Well, we may have on the call some people who don't know SPORE. SPORE is the implementation program, the IDMP implementation program at the European Medicine Agency. And effectively, there is a pending question, which hopefully will get the right answer. Some people think GTINs, so data carrier identifier in the IDMP jargon, should not be captured in the European Medicine Agency implementation. I want here to clarify something, because we have heard repeatedly that we have not only GTINs, but NTINs. In the GS1 space, GTIN stands for Global Trade Item Number. It is, as Jean-Gonzague was saying before, an identification key which has been or is attributed by GSK Vaccine to the product of GSK Vaccine. And there are some countries in Europe, for example, Austria, where you have another organization attributing an identifier, which is by, I would say, nearly by tradition, represented also in the same format as GTIN. But since it is not the manufacturer giving that number, but for instance, the authorities, then we say national trade item number. But that number is still globally unique, because the allocation rules are different, but the mechanic to have that unicity remains the same. So now, since I am working with GS1 for decades, and I know the NTIN story from the beginning on, I consider that an NTIN is a special case of a GTIN, but it's fundamentally the same. The size of the key, the way the key is represented in a database is the same. The allocation rule may diverge. So in France, for instance, you have an equivalence between marketing authorization and NTIN. Voilà. You are on mute, Jean-Gonzague, but you perhaps cannot unmute yourself. Wait a second. Whoops, Jean, ici. I have to use. Oops. You have it.
Yes, I was saying it's the same for your home country, Switzerland, where it's there's a link between both. But maybe I see Carlos on the line. Maybe Carlos can elaborate on this question.
So where is Carlos? Zoom, zoom, zoom. Here. Je ne sais si je vais le trouver. I don't see you, Carlos. I don't see you, Carlos. Oh, here you are. Here. Hopla.
Voilà.
Microphone. Yes.
All right.
Yeah.
Hello, everyone. Double check. Can you hear me properly?
Yes. Thank you, Carlos.
You hear you.
Thank you. Yes, indeed, there is currently a discussion whether we want to include this data carriers identifier at the level of sports, and not that we are not against or not, that we need to understand also the use case that we are going to give to those data carriers. And perhaps one of the concerns we have at the level of the EMA is that we will have many GTINs associated to the same PCID, and then this will create a lot of different versions in the same product, and therefore deviating a bit the product maintenance from the regulatory and pharmacovigilance point of view to more on the trade item supply chains, which is not really the main purpose of the sport. But there has not been a decision yet, and we are having indeed in fact a workshop next week to have more discussion on these aspects from the experts, and also to get and raise understanding at the level of regulators, not only from the side of EMA but also national competent authorities. And what I can say at the moment is that we keep the discussions, and if this is going to bring value both to regulators and for industry, I see no problem to include it, but we need to further understand what is going to be the use case, how it's going to be useful for regulators and for industry, and then how it's going to work from the technical point of view. As you know as well, these GTINs are also included in the EMPS database, and considering the data model on the EMPS database, there is also a link to the PCD, so we will always have the information one way or the other. This is the type of discussions that we need to have at the moment.
Thank you, Carlos. I hope that clarifies a little bit where we are in the question marks. We are going to have some preparation discussion later this week with a few of us with the European Medicine Agency about the use of this GT. And that will be reported back next week in a larger meeting. And then the implementation guide will be, the new release will be submitted to a consultation, and we will see how people react. There is another question which I want to just read again. How does this relate to the regulation of falsified medicine? Is this, where's my thing? Is this complex system set up to permit parallel trade despite the possibilities of breaching the protection against falsification? I think the answer is yes. It is a fundamental principle in the European Union that we have the free movement of goods. And the idea is to lower the barriers against the free movement of goods, and the parallel trade actually is part of this free movement of goods. So in the fight against falsification, they had to find a mean to mitigate this political vision, free movement of goods, and the regulation, local, and the measures to fight against falsification by serializing every single retail pack. So it's accurate. I see another comment here, but it is a bit, oh, no, let me remain on this. Somebody is disagreeing with what I say, because we have falsified originator in the system, often detected by parallel imports. Well, I will give the floor to Peter, because I don't know exactly what is meant. Well, with this, here we are. Hopla. Peter, you can activate your phone, actually. Yes.
Okay, thanks.
You
hear me?
Yeah.
Okay, now the falsified medicine was to avoid falsified products in the system. And the first cases we had with falsified medicines are with originators. The system only went a little more complicated because we have the principle of parallel import, but it was not the reason. The reason was really because we have started to see falsified medicinal products in the European system. I hope this clarifies it.
Jean-Gonzague, is it clear for you? I did not understand more than before.
So if I understood well, the challenge here is that the parallel import may be a way to enter falsified medicine in system. Is it correct, Peter?
No.
So I didn't get it. Sorry.
Because all parallel importers or distributors are under strict control. So they need either a GMP authorization.
Yes. Yes.
So they need the full legal requirements. That's not anything in a garage with, on a black side of a building.
Yes, for sure.
Yeah.
Yes, indeed, it's not FMD that will prevent the fact that a parallel import will bring or not, or someone that will bring or not falsified drugs on the market. FMD alone is not enough. At least FMD is adding one additional, let's say, way to control it. It's an additional check with the fact that you have to buy, if you buy a number of pills, you have to recommission the same number of pills. So there is no business model to fake something in between, because anyway you will spend the money. So indeed, it's not the only way to control parallel imports, parallel distribution, but it's one more. Let's say it like this.
Yep, it's a whole bunch of arrangements that we have done with the falsified medicines legislation.
Yeah,
and the code is only one piece of it.
Absolutely.
Yeah. Absolutely, yes.
Oh yeah. We are focusing a bit on the code because in the identification key chain, we are ending at some point of time from PCID to data carrier identifier, and that's the reason why we speak about the relationship between IDMP and FMD. This besides the master data.
Yeah, but I think one of the differences is with the FMD code, it's an in-out system. We don't know what happens between.
Exactly.
And with the GTIN, you have to rest. So if we, and this was a request from industry, that it's only an in-out system. So if industry is now requesting that we add GTIN or an as identifier, NTIN, or whatever, it's fine. But the consequence is that we need to build up such a complicated system which is related on in-out. Because if you add a GTIN or NTIN, it's added to complete distribution chain, which was the intention of the industry not to show to agencies.
I don't think it is, Peter. You know, I was in very early discussions in this domain. The way the European pharmaceutical industry wanted to address measures against falsification was, as you say, an end-to-end verification, and we don't have in between. That's absolutely correct. But identifying the medicinal retail pack, medicinal product retail pack with a serialized GTIN and a serial number, it's a bit the same in the US. with their legislation, the DSCSA. But in the US, they are requesting full traceability. So the both systems are using the same toolbox, but for whatever the reason, in Europe, they decided to have this end-to-end verification. Now,
yeah. And I have to say, we have been, from the side of the agency, we have not to be too happy about this. And therefore, I'm now wondering why industry is asking that we go back to the initial idea.
I have never
to include GTIN.
No. You know, even in my background, I have never heard the pharma industry asking to go back to a tracing.
No, but if you have a link to the GTIN, you exactly have this.
Yes, it is an enabler, but it is not regulated. And what is regulated is this ENVO implementation.
Yeah.
And now, if a pharmaceutical company XYZ wishes to implement full traceability in Europe for its own supply chain, like they do in the US, they can, but it is outside the regulation, the FMD regulation, and it is outside ENVO. Yeah, well, the both systems can exist in parallel.
Yeah, no problem with this.
So, but you know, we have the pillars to do more. Some do, and we have also a solution which is meeting actually the political requirements, meaning having an additional solution to fight against falsification. As you said with rights, we have much more than just the serial number and all these things. We have also the overt and covert on the packaging. We have, you know, API tracking and many others.
Yep.
Okay. Do we have other questions or comments on the chat box? I see nothing more yet. Well, okay. So we had in work package 1, we have had a few technical questions which have raised by national competent authority representatives from, I think, work package 3. And that was something targeted quite precisely on the fire implementation. We at work package 1 would like to understand what was the question, what was the answer, and there may be others, of course, and the others are interesting for us. This one we know, so that we can take this into account. If I explain just the standard development or maintenance process, we have a standard, we publish the standard. For ISO, after a period of time, such 5 years, there is a so-called systematic review. So the national bodies, such as DIN in Germany, NEN in Netherlands, AFNOR in France, these ones, are asked if that standard is good and should be maintained as is, should be revised and why, should be maintained and still improved, etc. They also have the possibility to say this standard has been implemented in my country and things like this. So we have this maintenance process, but knowingly, we don't have a large number of national competent authorities participating to these national mirror bodies in ISO. And we are here in this unique situation that we implement. So, and it is in the course of an implementation that one discovers where the problems are, where something is not clear or a gap really. And this is what we want to detect with your help. So we can integrate that in a release of the standard, or improve whatever. That's why we have this call open and open to everybody, because some of the questions may receive an answer outside of the limited, although it is large, limited team around UNICOM. Okay, I don't see any further question. Then I don't want to make it longer for nothing. I just want to announce you that we have a next committee of expertise early September. We tried to set up a date, but one of the key messenger cannot make it that day. It will be around PHPID, pharmaceutical product identifier. It will be approximately the same day, same time as today. And now I opened the questionnaire for you, so you can answer that very quickly. As you say, there are not so many questions. The questionnaire includes in the third question, if you have propositions for the next virtual session, you can post that to unicom at nictis.nl, and we will handle that carefully. Okay, give you a bit time to answer. I have now 16 answers for 45 participants, so please go. Okay, maybe also interesting to know when I ask, has this virtual session, first question, well fitting in your agenda, the day and the time, but I received one remark today. We should also send an Outlook invitation for the calendar. So that will be done next time. 2 invitations, one normal email and another with the Outlook. Okay, I have 25 answers. So it's nearly 60%. More answer, and then we will close this session. Okay, don't be shy. It's mostly interesting for us to understand what you think. Good. I see nothing moving anymore. Allow me to close this session, and thank you for having joined. I hope not only because you answered so massively yes, I hope it was useful to you. I would like next time to come with some questions in your basket somehow, which will enrich our conversation with burning questions from the work packages and beyond. Okay, this said, I will go back in my vineyards and let you go back to your occupations. Have a great rest of the day, and keep safe in the following days to avoid